Welcome to Conversations with the Winners. I'm Jacinta Goda, and I'm here today on behalf of the Robert Wood Johnson Foundation. And today, our conversation is with Emilie Harmeyer. And Emilie is the former program director of ShreveCorps AmeriCorps Program, and she's currently the director of neighbor services at Bank of Northwest Louisiana. Welcome, Emilie.
Thank you.
Talk to us a little bit about your work at ShreveCorps AmeriCorps Program, where you were fighting food insecurity on multiple fronts. Tell us a little bit more about that.
So Shreveport Green is an environmental organization that was founded in 1990. So when the organization began, that idea of community gardening was really about its positive environmental impacts and its community impacts, beautification. And over the years, we began to notice, of course, that there's some equity issues in our food system that could be addressed through community gardens. There's a large portion of our community that does not have good, reliable access to fresh and healthy foods. And so part of addressing that was in using those community gardens to grow fresh and healthy foods and increase people's access to that. So Shreveport Green has a program that they call the Community Gardens Network. It encompasses about 24 community gardens and school gardens. And then my role was to run the ShreveCorps AmeriCorps program, which enlists adults of all ages, of all backgrounds, to help maintain those gardens and to use those gardens to teach about nutrition to kids from low-income families, creating trust and creating community with them. And then sort of the third aspect of that is the mobile market program. And what the mobile market does is it's sort of like a farmer's market on wheels.
Talk to us a little bit about the connection between access to healthy foods and health equity in your mind.
My work at Shreveport Green and the need for that work stems from an equity issue in our food system. So in Caddo Parish, which is where Shreveport is located, about 1 in 6 people, maybe even closer to 1 in 5 people, experience food insecurity. And what's worse is for children, it's more like 1 in 3, which means that about 1 in every 3 children lacks reliable access to enough healthy and affordable food. And all of this stems from sort of a system that is just where inequity is baked right in. Anybody who has been to a grocery store can tell you that it's a lot more cost effective to cook a meal out of a box or out of a can than it is to cook a meal with fresh ingredients. Another part of it is the geography of the situation, right? Our built environment. And so we have low-income neighborhoods where there's not a grocery store for miles around. And so what we realized is the way to address these equity issues is in providing more and different resources to children that don't have these opportunities.
You approached this a little bit differently. You were not looking at one garden, you grew the number of gardens. Tell us about the systems change portion of this work. How did you approach it differently?
The way that we approach that is by establishing gardens, and not just one garden, like you said, but gardens all over the community, in every neighborhood that we felt needed it. And by doing that, we're bringing food directly into that neighborhood, and also bringing nutrition education along with it. And so developed a curriculum that included about 26 different lessons that incorporate that garden, that incorporate cooking foods from that garden, just getting kids involved in the process from the seed all the way to their plate,
Right. Emilie, talk about the mobile market a little bit, about how you engage the community in that effort.
We have to work with partner organizations. And so a lot of time that's engaging with other organizations that are also in the community, and sort of inviting them to be a part of this with us. So we go to community centers in food desert neighborhoods that need this sort of intervention, and say, can we set up a produce stand? Can we set up a farmer's market here?
Take us to a day in the life of the kids and in your program and the parents. Paint a picture for us.
Oh, let's see. So a day in the life might be the kids would get to participate in a nutrition lesson. Typically, they would have 2 or 3, maybe 4 AmeriCorps members who are teaching that lesson to them. And so it's my role to bring this team together, to train them in all these aspects, and to teach them to work with kids. And it becomes a really fun and collaborative experience where these AmeriCorps members are learning from the kids just as much as the kids are learning from them.
Emilie, as program director, I'm sure that it wasn't easy every day in
Right.
your effort to build this program. Talk to us a little bit about the lessons you learned and what can be shared with our audience.
I guess, a lesson that keeps coming back to me, something that I learned through this experience, is that it really does take a village, right? Parents, family, friends, teachers, and of course, coworkers and AmeriCorps members who joined me on this mission. And in turn, our mission was to become part of that village for the kids in our program. Even if they never decide that kale is their favorite food, I'm happy as long as they feel like they had someone who cared about them and supported them.
So, the award you received is about driving, achieving health equity through systems change. What does this award mean for you?
So our food system, as I said, is sort of rife with these inequities. And so for us, it's about changing that system, disrupting that system, and saying, food doesn't have to just come from the grocery store. Food comes from the ground, right? It just takes people coming together and working together, giving people the power to grow their own food and eat that food and eat healthy.
Right. And so what does receiving this award mean to you?
So having this award lets me know that my work has been appreciated and that it matters, that it's made a difference. And it means so much to me. And of course, the other thing that it means is that hopefully other people find out about this work, and hopefully they join in with us and they help us to make a difference in our community, or maybe they want to replicate this work in their own community. And I invite everyone to be a part of that, because it really does take all of us to make this happen.
You're absolutely right, Emilie. And on behalf of the National Recreation and Park Association and the Robert Wood Johnson Foundation, congratulations on your award.
Thank you.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2021 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.